Hi, I'm Carrie Harbaugh, Senior Product Consultant at Direct Supply, and this is the Panacea Air Advanced Mattress. This mattress is a limited low air loss, alternating pressure mattress that's indicated for use for residents that are high risk of pressure injuries all the way up through stage 4. Keep in mind this video, where we're going to show you setup, sizing, usage, and some cleaning tips, is meant to aid in your training of this mattress, but you should make sure that you've read the owner's manual as well, because there's a lot of great information in there and you want to be as familiar as you can with the mattress. So as we look at this mattress, I'm going to, for the purpose of the video, I've pre-inflated the mattress, but I want to walk you through what it would look like if you just got your mattress out of the box for the first time. So you would have a deflated, rolled up mattress that you're going to set on the bed deck and unroll it. You want to make sure that the logo that says Direct Supply Panacea ends up at the head section of the bed, as well as the CPR valve at the head section. During this process, ensure that the CPR valve is closed. As you move along the base of the mattress, you'll notice there are tie downs throughout the mattress. And you want to make sure that you're tying these down to the bed deck. This is going to keep the mattress from sliding off, and it's also going to help the mattress articulate with the bed. Ensure that you're tying it to the bed deck though, and not any stationary parts of the bed. Let's take a look at how we set up the pump. When we get to the pump, you want to make sure that you've put the air hose in until you hear a click, and then go ahead and turn the unit on. Now, what we want to do to get this one inflated is I'm going to actually reduce the firmness as low as I can go and hit max inflate. It'll take about 40 minutes to fully inflate this mattress. And as we inflate the mattress, I'm going to walk you through some of the other features of this mattress so that we're all ready when we get our resident to size the mattress. So I'm going to pull back our cover that just zips down. So I've unzipped it and now I'm pulling it back. And the first thing I want to point out is our static perimeter. This perimeter is really beneficial safety piece of the mattress. And the reason it is if you have air bladders that go all the way to the edge of the mattress, it's a lot like a pool floaty, in that if you're in the middle of a pool floaty and you roll a little bit off to the side, the air goes one way and you go the other way and you end up in the pool. We do not want that to happen to our residents. So instead, when this mattress is properly sized for a resident, they're going to be sinking down into this so that they're redistributing the pressure the best they possibly can. And as they roll to the edge of the mattress, this acts as a stabilizer to make sure it kind of pushes them back in the right direction. It also acts as a great piece to transfer from, because a firm surface is much easier to get up and transfer from than any sort of fluid surface like you would get in the air cells. The other thing I want to point out here is on these bladders, you'll notice there's little circles. These circles indicate where the air holes are. They're very tiny air holes. This unit puts out about 16 liters of air per minute, but it does a great job of keeping the surface of the mattress cool when they all work together. So when you're ready, you would zip down this cover, and we would go ahead and get ready to get our resident on the mattress. So I was just checking to see how we are. We're still on max inflate. For the purpose of our video, we might have to remove the max inflate for a little bit so we can just get through the sizing portion, but that's okay. When we look at the mattress deck here, or the mattress on the bed, we want to make sure we get the mattress all dressed with linens before we get our resident on it. So what we usually recommend is a deep pocketed linen. This mattress stands about 10 inches high, so you might have to get some different linens that have a little bit deeper pocket if you are using a fitted linen. You don't want to layer linens too much, because any extra linens on the mattress could result in a negative outcome for the low air loss and the pressure redistribution under the resident. So I'm going to get my volunteer here and show you how we go about sizing the mattress. All right. Whew. There we go. Now, the best way to size a mattress like this is to understand where the lowest point of the resident is and do a hand check method. So before we do that, I'm just going to adjust my pump here, and make sure that I've taken it off max inflate. Now you would wait the entire allotted time before we did that, but I'm going to move it to static because I want to size it on a static setting, and I'm going to move it just a little bit above its softest setting as kind of a baseline to start. So now I'm going to peel back our layer here, and I'm going to find the lowest point, which is usually the resident's rear end, and I'm going to hold my hand just like I was shaking someone's hand, and I'm going to go in between the cells under the resident's rear end because that's usually the lowest part. So I'm going to go ahead and set my hand in here, and the reason I'm doing this is I'm setting it on the bottom of the mattress base, and I want to just be able to barely do this and touch Jerry's rear end. If I can do that, the mattress is sized appropriately. It means he's sinking into that 8-inch immersible air cell as far as he possibly can, and the pressure's redistributed the best it can be. If I put my hand in there and I have to do this to find Jerry, then the mattress is far too firm and we're not getting the pressure distribution benefit that we should. If I put my hand in and I can't hardly wedge it under Jerry, the mattress is too soft and Jerry's at risk of bottoming out. So make sure as you dial up and down the firmness of the mattress, you recheck, and it might take 5-10 minutes to make the adjustments. So make an adjustment, recheck, make an adjustment, and then just note where the best pressure setting is for Jerry so that maybe next time you can start there and do your hand check method. So once we get it all sized up for Jerry and we know he's as comfortable as he can be on the surface, we've got him sunk in as far as he can, then we're going to come to the pump and choose our therapy. If we want to leave it on static, we certainly can, but if we want to change it to alternating pressure, I simply press the mode button. Now I get to choose my cycle time. I'm either going to choose, I can choose anywhere from 10, 15, or 20 minutes, up to 25, sorry. And that's really going to benefit Jerry because the more we can circulate pressure or circulate the blood, the better it is for healing. So if we're using alternating pressure, I would do it here. We already saw the firmness adjustments at the bottom here. The only other button on here, other than the max inflate, which we talked about, static and alternating pressure, is our alarm silence button. And this is just an audio and visual alarm, so if there is something wrong with the amount of pressure that's being put out from the pump, or if the mattress itself is losing pressure at a quick rate, this will both blink and shoot off an audio alarm that you can hear. So then you come in the room, you would press the silent button, go back and reassess what's going on and make sure that Jerry is taken care of and he's on the surface that is suitable for him. So really very user-friendly controls. The other thing we want to take a look at in this quick short video is how to clean the mattress. And this is a 4-way stretch cover. It's very, very breathable. With that, we know we have to take good care of the cover because there's a lot that goes into a cover that's very breathable, and we want to make sure we're taking good care of it. So if we need to clean this cover, just everyday cleaning is just a mild soap and water will be just fine. If there's a spill or an incontinent episode, a quaternary disinfectant or a pre-diluted bleach wipe would be good to use. Outside of that, your mattress cover should be moisture resistant, so you shouldn't see anything going through the cover, and you always want to keep the cover zipped closed when you're cleaning so that you don't get any extra moisture in it. The only other thing I want to mention on this unit is there is a filter on the pump, and you get to the filter just by turning the pump around, and you can see this little window here, and all it is this little white filter, and when the filter is no longer white, you just peel it out and replace it. We don't indicate any sort of schedule for you to replace the filter on. It's really up to the air quality in your building. Sometimes they can last a month, sometimes they last 6 months. It just really depends. As you continue to use the mattress, you'll start to get a feel for how often that filter needs to be replaced. That is the Panacea Air Advanced Mattress. Please, if you have questions, reach out to us at Direct Supply. Your account manager is a great solution. Otherwise, visit us on directsupply.com.